You mentioned the idea of sub-diagnoses, and I want to be careful because, again, we're talking about assessment, not necessarily diagnosing things.
There's this issue of kind of lumping a lot of different patients together. As I was just saying, there's a lot of different symptoms involved. People have different sets of symptoms, and then there's this smooth spectrum from depression to anxiety. There's a substantial overlap in the drugs that are prescribed for the two conditions. Sometimes people prescribe anxiety drugs for depression, sometimes maybe vice versa. And then you have antipsychotic medications that come in for bipolar and schizophrenia. And there's all of these, different symptoms. A lot of these disorders actually are correlated anyway. And so people will be diagnosed with multiple different disorders. And there's a lot of then leeway to prescribe them a lot of different things. Sometimes people are taking lots of different medications, right? And so this idea that it's just about, figuring out if they meet the threshold for some diagnosis and then assigning the treatment that goes with that diagnosis, I think that's something for a long time, people have been trying to move away from that, right? What you really want to know is, let's take all the symptoms that we can measure, all of the different dimensions, and try to predict what the most effective treatment will be. Right? And not have to use necessarily diagnostic categories in that process. That would be the ideal, right? But it's just, it's a difficult thing to do. So subdiagnosis is one way. It's like, okay, let's divide up depression into different subtypes of depression. Some might be responsive to some drugs, and other subtypes of depression might be responsive to other drugs or other treatments. Not saying you should just prescribe drugs. Actually, oftentimes therapy is better, but it's, other kinds of treatments get more expensive, more inaccessible. You can do group therapy, which is a little cheaper. But anyway, there's all these different treatments to choose from. And you want to predict what the efficacy is going to be for a specific person from their symptoms. So that's the goal, really. And we're getting a lot closer to that if we can measure people's actual behaviors in everyday life, because that's really where their symptoms reside, as opposed to just talking abstractly about them in a short appointment that occurs at some arbitrary moment in their life when they might be in some arbitrary mood.